All right. Good morning. Welcome to Project Echo. I'm Will Schmeckley. I'm a project coordinator here at the Nebraska Medical Association. Just got a couple of housekeeping things, and then we are going to turn things over to Brian today, who's going to talk about his experience. This slide here just says everyone involved in this event today. We have no financial relationships to disclose. We're obligated to share that slide. And then we're also obligated to share our funding statement here. We are grant-funded projects. Our grant funds come to us from SAMHSA, the Substance Abuse and Mental Health Services Administration. And then those funds come to Nebraska Department of Health and Human Services, and then they pass those on to the NMA to help make these trainings possible. In case we have any new folks here, I think most people are pretty familiar and have been on these trainings at least more than once. But ECHO stands for Extension for Community Health Outcomes. So Project ECHO are trainings and consultations about treating patients with substance use disorders and or pain. We've got a hub team of 6 experts. So we do these ongoing trainings every other Friday. And then we also have consultations available. That's part of the grant to make consultations available. So if you are a medical provider and you need a consult about a patient with pain or substance use disorder, just get in touch with me. You've all got my email, my phone number's there on the screen, and I can connect you with one of our 6 experts. And just a reminder where we are in this current Echo series. We do these in groups of 4, so we're on the second one here. And 2 weeks, Ed will be doing injectable buprenorphine and naltrexone, and then the last one in our series, Stephanie will be talking about psychosocial challenges with SUD treatment. Then we'll be off for a month, and then we'll be back with another set of 4. Okay, so the senior certificate, we tried a little something different last time. It didn't work so well, so we're just going to go back to the old way today. Just a quick evaluation survey will come. Um, that'll come to your email. That'll also be in the chat at the end of this training here. And once you complete that survey, that certificate will pop right back up. If you have any troubles, again, just get in touch with me. And then our expert panel, I'm going to stop sharing my screen here and I will let them introduce themselves. Let's see, Ed, would you like to go first?
Yeah, you bet. Good morning, everybody. Ed Kaiser here. I'm a family trained nurse practitioner in Omaha, Nebraska. Have been treating patients with substance use disorder for the last 7.5 years. So excited to be with you guys this morning.
Ed and John.
Good morning, everybody. I'm John Massey. I'm a pain physician in Lincoln, Nebraska. Happy to be here.
Thank you. And Mary.
Good morning. My name is Mary Ellis. I'm a nurse practitioner and an attorney, and I work in both fields and sometimes combined with a lot of mental health and substance use issues.
Thanks, Mary. Alex and Stephanie, I don't see you guys on. If you are on, speak up real quick here. I don't see him. So in that case, I will turn it over to you, Todd, and I will let you introduce our speaker for today as well.
Good morning, Todd Stoll. Good to see everybody again. We are fortunate today to do things a little bit differently and have a guest today that's willing to talk with us about a experience. Brian Wasson is a individual who has 2.5 years of now sobriety and in recovery from opioid addiction. And he's a former police officer who lost everything due to his addiction. He was incarcerated as a result. And now he wishes to talk with us and share his story. So, Brian, thank you so much for being here today and your willingness to not only share with us, but the courage it takes to do something like this. So the mic and the floor are yours.
All right, thank you, Doctor. I appreciate it. And just a little caveat to everybody. I used to do a lot of public speaking in my career as a law enforcement officer, and the experience that I'll detail for you today, what I've gone through, has certainly changed my path. So I'm hopeful that I'm still somewhat articulate and that I can deliver some information that's valuable to some of you. And I'll talk a little bit at the end about how I would end up meeting Dr. Stoll. and which led to my being here today. Uh, so my story really starts. I'm an identical twin. My brother is really good looking, and he's an assistant chief of police in Gillette, Wyoming. Um, and he and I, in the house that we were living at the time that I first have memories of wanting to become a law enforcement officer, I would say we were between 4 and 6 years old. Um, we both wanted to be law enforcement officers our entire life. Everything we did in our high school years uh, was geared towards that goal. Uh, Ultimately, we ended up going into the military, which we desperately needed to grow up. We needed maturity, discipline, and we got it in the United States Marine Corps. We both returned then to this area and began careers in law enforcement. He in Gillette, Wyoming, and myself at the city of Scottsbluff, Nebraska. If you Google my name, um, you'll see information that I'm not proud of that and it'll definitely encompass all the good things that I did over my 26-year career because the end got tumultuous for me. And what happened essentially was in 2002, I was working with the drug task force out here. I became injured after a foot pursuit and crushed T12, and that that initiated my use of opiates. And in 2002, it was pretty easy for me to get quite a bit of at the time it was Vicodin. I think it's called Norco now, but hydrocodone. I was getting probably over the first, that I could have done a surgery. The surgeon out here wanted to do surgery, but he said I would get a second opinion because I just love doing surgery. So I ended up going to Fort Collins, see another guy who says, with what you're able to do, I would hold off, and then as degeneration sets in years later, maybe consider this surgery. And so instead, we just treated the pain that I had. Um, I know there was times where I was getting scripts for 180 Vicodin at a time. At the time it really wasn't that big a deal to wait 30 days. So pretty quick. Definitely within the first year, I had a very I would say a physical and mental addiction to opiates. And at times, I remember I would be asked how the pain was doing, and I really didn't know because I was taking so much of the Vicodin. Um, but that led to me needing the drug, and that really carried on for years. I wish I could say exactly how many years, but things get a little foggy at the end here. Um, well, I was a police officer. I actually got promoted rather quickly. I was a supervisor within 5 years, and then I think 10 years into my career, I was promoted to captain. So I had the second highest position in the department. Um, our agency helps with prescription take back um, events throughout the year. So when probably in 2000, and I would guess it was probably around 2010, 12, my doctors started saying, "Hey, one of them said you're done," and sent me out of the office with no assistance of getting off the drug, and that led me to start taking a handful of pills out of these take back proceeds that we would store until we could dispose of them at the police department. This was all done obviously without anybody's knowledge. I wouldn't have survived. Um, I wouldn't have kept my job had that been discovered. And that goes on for literally years as well. So much so that ultimately I would start bringing the bucket home. So let me explain these take back events a little bit. Um, our local Keep Scuffle, our Keep America Beautiful group, they would host these events. They would fund them where people could bring in all their old prescription medications, and it didn't matter what it was. And they would bring them in, and they couldn't. The driver for the hazardous materials contractor that they would hire couldn't. It was their policy that they couldn't take narcotics. So a bunch of us, 10, 15 of us, and I always participated. I wanted to be a part of it because I needed to follow the drugs. We would sort out all the narco stuff. We would have a couple pharmacists with us to help us. And after doing that for 10 years, I knew if I picked up a bottle, I knew if it was a narc or not, and we would sort that off to the side. Well, then the police department would take that for incineration at a later date. But before it would make the incinerator, I was taking pills out of that, and I was taking every opiate. Again, I knew, I knew every pill that would keep me from going through withdrawals, and I would go through and sort through these buckets and pull it all off and put it in Ziploc bags, and I would probably towards the end of this part of my story, I was probably getting 2, 3 gallon-sized Ziploc bags of pills, and it would be everything: Vicodin, Percocet, Dilaudid. I mean, everything opiate, and Tramadol. That's I could survive on Tramadol. It would help keep me from the withdrawals for sure. It wasn't as comfortable as maintaining my opiate use, but Tramadol could I could work with Tramadol, and that goes on again for years. But as the medical community starts scaling back their prescribing of those drugs, then obviously that's going to affect the amount of drugs that are being turned in to at these events. So that starts to diminish. There was a time towards the end of that process where I just couldn't get it anymore. Didn't have enough to last very long. So I noticed in the evidence room that we were starting to dispose a lot of heroin and fentanyl. Now, mind you, I'm a captain at the police department. Nobody knows that I have an addiction at all. I'm working, and I'm not the consumer that I see on TV sometimes, where they're just zoned out on the toilet after they shot up heroin. I was never that. I was taking enough to keep from going through withdrawals, to keep from sweating at work, to keep from vomiting at work. But by this time, it's a lot. I mean, there were days when I was taking the pills from the take back event that I probably would have put, I would guess 30 to 40 pills in my pocket in the morning when I left the house for work, and I would be out when I got home. And the acetaminophen's coming right along with that. And I was very mindful of that too. I was convinced that I would probably die, would kill myself, and that didn't matter. And then certainly when I started to use the heroin and fentanyl, I seriously felt as though it would end in my death. I would just die, and it didn't matter. It did not matter. Initially I was just taking the blue fentanyl pills orally, but that evolved into me smoking the pills and smoking the heroin. I would say at the very end, before I reached out and was able to get some help, I was probably smoking 20 to 30 of the blue pills a day. And fortunately, we would have had a case about months later that had already gone through court. That was also very, very important to me in my rationing. or my rationalization was that I couldn't touch an active case. That's like the ultimate sin. None of this that I'm telling you all today has not been disclosed to investigators that will ultimately um, investigate me and lead to my going to prison, which I'll describe in a little more detail as we get further along. But at the end, with the fentanyl, the high is so intense and but short-lived. The effects are so short-lived that it just became really, really out of control. And I, I wished I was wishing at the time that I would just die. That was going to be the only end, because when you're a captain of a police department, um, you're a very public person. I was also the one who did most of the speaking with the media in our community, so everybody knew me. Um, it just wasn't, it kept me from just reaching out for help for all these years, because I was certain that had I reached out for help, I probably would lose my job, and that was what was sustaining myself, my three kids, my wife at the time, and it was just going to be devastating to reach out for help. And certainly now I wish I had, obviously, but it just wasn't something that I was thinking. I was thinking more um, about dying to end what was going on, to end this cycle, than I was anything else. So smoking 20, 30 pills a day, that I read reports every day. I'm watching body cam video to supervise these officers that are working with me. I'm seeing people, you know, that are dead, having overdosed, and none of that concerned me. The drug, especially once I started using the heroin and fentanyl, was it just it had total control of my life. There was nothing that I could do. Um, until one day, I have three kids. They're adult kids, and two of them still live with me today. I would have suffered a divorce. Unfortunately, my wife struggles with alcoholism, and in 2020 we divorced, having been separated for about 5 years before that as well. Um, and So it was me and the kids. The kids stayed with me because of, believe it or not, in what I'm describing to you, my opiate use, this was a more stable environment, um, because it was a little harder for their mother to conceal, her disease. It was a little more, she was starting to have events where we would have to carry her in the house, or something like that. So they ultimately opted to stay with me, and that's what ends up intervening in my life. My daughter caught me smoking fentanyl in my closet. Um, the look the look that she had on her face when I realized that she was standing there watching me was what ultimately led me into recovery. Um, the uh, Sorry, guys. Um, she I should back up just a little bit. So my daughter, my middle child, had a boyfriend whose grandmother I knew as a police officer could get or purchase drugs. She had been part of drug cases before, and because my daughter was dating her grandson, I was using her at the very end to get me fentanyl, and I was paying $20 a pill. Just like you hear stories of. Um, and the irony of this, there's so many ironies to where things kind of just came together at the end. So I'm out of control using drugs on a nightly basis. I'm picking up this woman and I'm driving her to Scottsbluff, the community that I work in, and I'm dropping her off so she can walk to a house to go get 20 fentanyl pills, and we're talking $400, and this is almost daily, um, and uh, and it would ultimately be my daughter catching me in the closet smoking fentanyl around the same time, within a couple days of this person who I'm using to get me drugs telling me that there's a MAP program in Scottsbluff, which I didn't know about, nor had I done much at this point to really try and find. I knew what medication assisted treatment was. I knew um, that at some point it would come to our community. I didn't know if I would survive until it got here, nor if I would be willing to try it. Um, but within a 2 day time period, my daughter caught me in the closet. My drug dealer, while driving, she started to get concerned about me too, because by the time I would pick her up in the evening to go get the pills, I would be in, pretty heavy withdrawal symptoms, sweating, shaking legs. And she started to get scared of me. My drug dealer, I'm a cop. My drug dealer tells me that there's a MAP program and she thinks that I should really get into it. And within a couple of days of those two things happening, I finally reached out for help. It wasn't easy, obviously, and you guys, it sounds like you guys work with people in these positions. It would still took some fortitude to get to where the Suboxone started to help. So it was a pretty tumultuous time. I relapsed one time during, I didn't think the subs were coming quick enough. So I ended up using one time, but on April 15th of 2020, what would it be? 2.5 years ago, almost 2.5 years ago, I was able to enter a program where I was in inpatient, or I'm sorry, I went to IOP, and was part of a MAP program, and I was thriving, loving it. For 20 years, I just wanted to be off the pills. I knew where it was heading. I knew I was in detriment. I was going to lose my career or my life. One of the two things was going to happen. Um, and I got in recovery and I started helping other people. I was doing so well. Uh, but in my work in recovery, and how honest you have to be about things that are tough, things that are just difficult to deal with and explore, uh, ultimately led me to um, self-reporting myself to the police chief of what I'd been doing in the evidence room. And let me share a little bit more about that. So the chief, my chief of police, I'd worked with the guy for, gosh, 20 years, 25 years probably. And we were close. We were both captains. We were both promoted to captain at the same time. And he had been the police chief for about 5 years prior to this. Um, he had aspirations to become in city government, a higher level of city government. So he applied for and became the city manager. And there needed to be a new police chief at Scottsbluff Police Department. Him and I, around the same time that my daughter caught me in the closet and my drug dealer told me of a MAP program, a week before that, I was at a conference and the chief was um, introducing me to other law enforcement professionals across the state and telling them that he was going to appoint me as police chief. Um, So around that same time, just yet another thing that pushed me into recovery was that I wasn't going to allow this guy to appoint me police chief and then do this or then have something found out. I should also say that we had just hired someone from who used to be a member of our police department to help us manage the evidence room. And so things were there were some discrepancies with things that were being destroyed. He was starting to notice some things were missing from cases, and these things were drugs. So so it's not like I just, 100% had an epiphany. To be honest, it eventually I would have to start lying to people that I wasn't willing to lie to. And then I don't, it's hard to say whether or not it ever would have been figured out that it was me taking it or not. But for for the 3 months prior to this occurring, I was, everything I was learning, everything that I was doing was to be honest and accountable to myself and to the program. So I ultimately it was the weekend after the chief was introducing me and saying that he was going to appoint me as the new police chief that I drove to an attorney's office. First thing in the morning, I met with her briefly and told her that we needed to call the police chief and have him come to her office so that I could tell him what I'd been doing. And that's yet another pretty devastating day. Uh, I was I was living my dream. I was a law enforcement officer, which is all I ever wanted to do. Excuse me. And I was not only was I, going to be ending my career, but I knew this would launch a criminal investigation, which it did do. Um, the Nebraska State Patrol investigated. I cooperated fully with their investigation and told them everything that I did. I not only had I taken drugs, but I had taken money to buy the drugs that I was buying on a daily basis. At the end, the part where I'm talking about the fentanyl and stuff like that, that was really a just a few month period. It, things got so out of control that I just couldn't sustain it. I couldn't steal enough money from the room without it being detected, obviously, and drugs. So um, it was just a perfect storm. Everything kind of happened at once, and the only fortunate thing about calling the chief and telling him that what I had done would be that I had already achieved sobriety and was in recovery. So had I tried to do it while also dealing with having to figure out where I'm going to get 30 pills that day, it would have been much worse. My my attorney called my brother, who dropped everything and came and was able to help me navigate the next few days, which were pretty rough. Ultimately, I was interviewed by the State Patrol. I paid back all the money that I had taken by taking a loan from another friend, and and they my with assistance of my attorney, she worked out a plea deal with the Attorney General's office, and that ultimately led to me meeting Dr. Stoll. My attorney wanted to have someone at the sentencing that could kind of provide the judge with information about addiction and the potential detriment to my recovery with incarceration, which he did. a great job of. I'm not real sure that the judge even paid attention to that in what I was seeing, but ultimately I was sentenced to 40 to 60 months in prison. Um, as a police officer of 25 years, I knew that typically in the state of Nebraska, if you get sentenced to 40 months, you're going to do 20 months in prison. You're going to do half of the low number as long as you don't get in trouble. So I left my family and everything here, expecting to be incarcerated just short of 2 years. And fortunately for me, LB 50 had just passed, which I didn't know this part. I knew a lot about LB 50 because there were parts of it that we actually helped support. But the part that I didn't know about was if you were an offender and it was your first felony conviction and it was for a nonviolent crime, which I was charged with 2 counts of theft, felony theft, and then you got even more of a departure from that 50% sentence on the low end. So I ended up doing 10 months in prison. Um, but I can tell you 5 years before that, prison would have been the last thing I ever thought that I would be a part of. And it's all prison's not the best place to be if you're a police officer. So the next 10 months were pretty difficult, and I'm still currently on parole. I have until next June before I'm off parole, but none of that has affected my sobriety. Um, I'm literally 2 years, 5 months clean and sober. I'm very happy. Um, one one thing with this group of people that I think is kind of interesting is the only drug that I was offered in prison was buprenorphine. Um, it was available. It was very expensive in prison. I didn't take it, but it seemed ironic to me that the only drug I was at, I should say I wasn't at NSP. I wasn't at Tecumseh. I was in Omaha, which is where um, former police officers go as long as you meet the criteria. It's a little bit safer campus for a former police officer. But the only drug that I'm aware that I was ever approached to and offered was Suboxone. Um, there was a couple guards that were arrested and charged during my 10-month stay, having brought those drugs in, but there was some diversion. There was actually the 10 months I was in, there was only me and 2 other people that were prescribed um, Suboxone, and I was taking 3 doses of 8 milligram on the outside. They started off only allowing us 2 doses, one in the morning, one at night, and then because of the inconvenience it caused the night guards or the night corrections officer, they actually changed that to forcing us to take both doses in the morning. And I did that for about 6 months, and um, so yeah. I mean, I was grateful that I was able to take Suboxone in prison because initially it looked like it wasn't going to happen at all. But so I would have gone through some, suffering at least for the first, month or two when I first got there. So I was grateful to get it, period. But it's still, you know, it's still pretty taboo to correction staff, and it's understandable because it's available on the yard. I think it was being sold I think to buy a full 8 milligram pill, it was $220 on the yard. So people would buy a half or something. And I mean, I was a police officer, even though I ended up getting convicted of felonies and going to prison. I wasn't I wasn't cheeking my pills. I was taking them as I was supposed to. Nothing that I was doing did I want to stay any longer in prison for. So I did everything by the book. Um, yeah, I'm sorry I got emotional in the middle of that. But it's just when you I know many of you are living your dream in healthcare, and when you your life's path changes as drastically as I've described mine has, it's been difficult to deal with and manage at times. Currently I'm working. One thing that I used to do as a police captain, which can be a very stressful job at times, I would look out my window of my office and I would see the parks department guys mowing the grass at the police department. And I would think, gosh, wouldn't that be a nice job? You go home at the end of the day and no stress. You might worry about whether you change the oil in the lawnmower, but nothing that affects people's lives. And for 20, the better part of 25 years, I was day after day after day, I was handling other people's problems when I had a load of them myself, and I wasn't taking care of mine. So I would take care of other people's problems day in and day out. So 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 other things start to become a little attractive to you then, mowing grass or something. And what I'm doing now for a living is I'm operating heavy equipment. I'm driving a loader, which is very similar on a larger scale of mowing grass. So I'm happy. Um, my stress level has gone down drastically. Um, both not just because of the police profession, but because I'm not living the lie anymore of addiction. And it's been it. I'm a big believer in things happening for a reason, and although I haven't figured out why yet, I know that I've gone through this for some reason. And when, as soon as I got out of prison, I told my attorney that I wanted her to reach out to Dr. Stoll for me, and because he helped me out, and I wanted to do the same for him. So that's why I'm here speaking to you guys this morning. And um, unless I can kind of pull together some other thoughts, that might be about the end this morning. Unless you got some questions, I'm happy to answer anything.
Mhm. Thanks so much, Brian, for sharing your story. That's very well told and very moving story. We can open it up for questions or thoughts. Any thoughts from the Echo panel? Todd, I see you unmuted. Did you want to chip in?
Let's let others go, and then
Sure.
yeah.
Can I
Yeah,
ask a question? Can I ask?
yeah, yeah, go.
Um, that. Thank you. By the way, that's as moving of a presentation as we've ever had. I found myself spending all of your talk trying to think of what's your perspective? How can society and how could the state of Nebraska, from a policy standpoint, how could we have helped you in the midst of that in a way that would have made this an easier path for you than it ultimately had to become? Have you reflected on that quite a bit, or what do you want to share about that?
I mean, I have, and then I get hung up on, so I'm describing my addiction, and although it was progressive, even at the end when I was using fentanyl and heroin, I still knew I wasn't like I wasn't zombie. After I shot up, I wasn't like nodding off. It wasn't like that for me. But so I still knew after every time I used, um, and every time I took money from the evidence room, drugs from I still knew that it was wrong, and I get hung up on the fact that I totally betrayed everything. I betrayed the oath that I took, and everything about it. So it becomes hard for me. That you've got the it's it's very similar in any other profession. It's taboo um, to admit that you're struggling. You got those barriers. I'm going to be treated differently. I'm going to be ostracized, things like that. So I don't know what I mean. The education um, of the entire of our entire society on addiction is what needs to expand. Even we had a saying at Scottsbluff PD that the difference between a good cop and a great cop was compassion. And I thought, and we pushed it. When new guys would come, we would encourage compassion and empathy um, and I thought we were doing a pretty good job at it. And after going through this and entering, feeling what it's like going to the sentencing hearing with your kids standing there and being ripped away from them for 10 months, 40 months, whatever it's going to be, there's still, I still felt that I wasn't really scratching the surface of the empathy of the compassion that I showed people. Every young officer is gung ho and goes out and I'm going to arrest every drug dealer, this, that, and the other. Um, and I did the same thing. But when you deal with people who are addicted, um, that's the tough part. In is how do you who's doing this recreationally and who is just out of control. There's how can we identify those people, and then there has to be a willingness of that person to get help. I don't know the answer to your question, Doc, and I wish it's something that I've given a lot of thought to, and I just haven't come up with what that is yet, because it's going to. I mean, I think there's been a lot. The opiate epidemic, I think, has certainly exacerbated any efforts that were done prior to that. Um, but I don't know. I just don't know what it takes um, to get because that was the biggest thing for me. I knew I was going to lose my job, my income. Um, I was going to be shunned in the law enforcement profession extensively, and rightfully so. Um, I I don't know. I don't know the answer to your question. One thing that was kind of troubling for me is that I was a police officer and I didn't know that we had a MAP program. And it sounds like when I entered it, we had it for almost a couple years. And if I would have known that, because there was many times where I would try to quit myself, or um, I would have, I would have. I remember one time I went to Sioux Falls, South Dakota for work. I was helping to acquire a new records management system for our entire county, for law enforcement records, and they had a methadone clinic, and I was like, God, why can't we get something like this in Nebraska? Um, and and that was before it was in. It definitely was before I heard about buprenorphine or Suboxone. So yeah, I mean, if there's more, I think if there was more knowledge about the MAP program, and I'm talking, I guess, then more specifically about opiate addiction, um, and then so more people learning of its existence and the accessibility of it would be probably where I would start, because if I would have known 2 years prior, I wouldn't have been in the evidence room. I would have been in the evidence room, but I wouldn't have taken from any cases. I would have been taken from the stuff that was being diverted through the take back event, which wouldn't have been criminal. I would have lost my job, but I wouldn't have gone to prison. Um, so yeah, it was so ironic that my drug dealer is the one that told me of that, and I was a police officer and should, you know, I say I wasn't a real cop. I had been a captain for 16 years, so you're a little bit isolated from what's really going on the street at that level. But yeah, I can't imagine that I was the only one that didn't know that we had some resources in the community that could help with the opiate use, and it was ultimately my drug dealer that told me that. So that would be my only recommendation or my only thoughts right now on the subject. But it's something I do think a lot about. Um, and if I come up with something, I'll circle back and try to get that info to you, Doc. Appreciate it. I see a bunch
Got
of comments too, thanking me. Thank you guys all very much. It's a story I wish I never had the opportunity to tell, but if I help one person, I'll be very happy. Save one person from going to prison.
We've got a couple questions in the chat here. One from Mary asking, was there ever an opportunity for you to do drug court?
Um, I don't believe so, and that's a good question. I have a relative who was arrested 4 times by my police department. Each time he had cocaine, heroin, meth, like 5 or 6 different kinds of drugs, and decent amounts of it. And he got probation the first 3 times. It was his 4th time getting arrested that he got sentenced to prison. Now, granted, I was in a place of trust, um, significant trust, and I exploited that. But I didn't get no offers of probation or anything short of that. The judge that sentenced me set an example with me, and I went straight to prison. But no, drug court was not offered to me, and nor was it ever discussed in any negotiations with between my attorney and the attorney general's office, to the best of my knowledge.
Can I just follow up on that I'll just go real quick because I know other people have questions, but since drug court is a problem-solving court, and I don't know if every county has it, but you had mentioned that you didn't have any violent crimes, which would have, in a lot of counties, made you more apt to get into that program and get the treatment that you had needed along with that. So I guess I'm a little bit sad that that didn't happen for you. That's it. So,
Thank you.
yeah.
Thanks, Mary. We had a question here. This one just came to me. It wasn't in the group chat. Asking about, was it difficult to function and do your job while you were using heroin and fentanyl?
Only in the very end when I was smoking 20 pills a day. And the only thing that affected my work was that I would need to leave. And I would be in my work car smoking off of foil. I would just go, like, say I was going to get you know, a soda at the mini mart and drive around and just smoke a pill to because I would be, feeling the effects of withdrawal. So, and again, I never ever, I mean, I accidentally a couple times nodded because I like when I was taking 30, 40 Vicodin a day, 50 Vicodin a day, there would be times where I would take five or six and then forget that I took five or six and take another five or six. And so I might have nodded from my memory, not more than five times over 20, 21 years. So I wasn't using to get super high. I was using just enough. And I would ration when I say I took a gallon Ziploc bag, that would have to last for about 6 months. So it's not like, I really was trying to ration. Like there was even times where I would say, okay, I got 50 Vicodin left or 50 Percocet left. I need to make this last for 10 days. So I would, and that this is a little low ball in it, but I would peel five off, a day and ration it. I needed it to last because there wouldn't they we did two take back events a year, so they would what I would get would have to last 6 months. Otherwise, I'm going to be without. And by that time, when I was doing that stuff, is when the doctors weren't prescribing me anymore. So it's not like I had anything to fall back on.
Another question here. Were there any signs that others may have been able to pick up on or that you identified as well? Like any tips for providers that might help them investigate further? Um,
Yeah, so
yeah.
so I did go to the quick cares, um, you know, several times, and we have one, two, three of them in Scottsbluff Gearing community, and I would go in with just like my back just was dying in pain to get, and I would get like 21 10 milligram Percocet. Um, so if you get someone like that, even if they're coming in, I wouldn't go to them more than twice in a year. So like every 6 months. So they're finding the drug somewhere else in between, but there's just times where they know it's easier to get, or for some reason they can't afford it or something. So even someone that comes in with chronic pain, um, very very sporadically, um, could be in crisis, and Eva, if any of those quick care docs would have said, "Hey, Brian, are you sure? Are you sure you're not addicted? And do you know about the MAP program?" Um, I might have learned of it that way, and might have been at a point where if I'm going to them, it's because I couldn't find it anywhere else. So um, they could have steered me. I don't know how I would have responded to that. But being detected, especially if you have someone in a position like mine where the public's very aware of you. My biggest thing was I couldn't be exposed because that would ruin everything. So if a provider told me, Brian, you need help, and there's a MAP program in town, I probably would have. That probably would have been it right there. I probably would have done it. And I know it's hard to predict that, and we get very very creative and conniving to get the drug, and I did it no different than anybody else. I exploit. I had an additional option of exploiting the hell out of a very sensitive position in the community, and that's the only thing that separated me from the person who's stealing something out of a car to go sell it to buy pills themselves. So thanks for that question. Yeah.
Maybe the final question I'll ask, and I have several, but I think I want to try to make it relevant to the group. Right, um, very gracious kind of with your not only your time but the depth of the story and the details are obviously difficult to discuss and pull on a lot of heartstrings for many people. What are the key ingredients? And so I thank you for that. Incidentally, I thank you for being here today and your willingness to do this. For you, and here's my question: what are the key ingredients for your recovery?
Um, I wish I could take a picture of my daughter's face when I saw her looking at me when she caught me. I wish if I put that on a poster, I can't imagine it wouldn't affect others too. That that was the biggest motivator for me, Doc. You know, interesting. I was in prison there was a couple guys that I got. I don't know if kind of close to is the word for it or not, but there's one guy in particular. He was on his fifth time in prison. He was doing his fifth number, and I got closest to him than anybody else. And every time he was in for meth, um, he was using meth. And there's just some people that are okay with that revolving door of coming out and using, selling until you get caught and going back in. For for me, for me, it still came down, Doc, to I had to want to be well. It still takes. That's the part that that's the part that if somebody taps into ever figures out how to get how to force someone to want to get better, you've got the world by the tail. It still required that, but I mean, because I was losing everything. If that the stories that I heard in prison, the the end for me should have motivated me to continue using. I mean, I lost everything. I lost my wife years before, and that was likely it's not just her alcoholism that led to that. It's my addiction too, certainly. And I lost my job. I wasn't. I mean, that's when people really go downhill, right? So it was me seeing my daughter's face and not wanting to put them through that, and a desire to live, a desire to be healthy. It still takes a lot within yourself because I think I went in on a Thursday for my mat appointment and Saturday. So I took Suboxone Thursday afternoon, Friday throughout the day, and I'm going through withdrawals because it's taken time for that to build up in my system, and I'm coming down off fentanyl. Um, and so I ended up smoking a couple pills, buying and smoking a couple pills on that Saturday. So it still took me. It still takes that person to want to get better, and if there's a way to tap into that part of it right there is where we solve it. And none of us have that ability, but because the example of the guy that's been in 5 times prison, he probably will be in a sixth time. I plan on Googling his name like once a year, and I bet I'll see him getting sentenced to prison again. He just those there's just some people that are okay with the vicious cycle, and that wasn't for me. I was I suppose a lot of it had to do with my brother too. I mean, um, he was very supportive. He never, I mean, I expected him to drive down here and start punching me and being pretty angry with me, but he, he I wouldn't have made it through the first few days without his help for sure. And I'm talking after I was sober by now. I'm talking when I went to my chief and told him that what I had done. I mean, I couldn't think straight, and my brother did a lot of the thinking. That's a missing piece in a lot of these stories that we talk about or hear. They don't have the family support, so filling that void is probably pretty critical too somehow. And I don't know how we do that.
Yeah. Thank you. I know we're at the end of the time now. I'm deeply grateful, and I think those that attended today are for your
Can I
willingness to
can I
share.
put my can I put my email address if anybody
Please
has
do.
additional
Yeah.
questions or anything?
Please do.
Yep.
And please, anybody that wants to reach out, I'll try to answer any question I can. Um, I'm doing despite my appearance this morning or demeanor. I'm really doing good. Um, I still have two of the kids here at home with me, and the only reason the other one's not here is she's living with her boyfriend. They're going to school and trying to figure out what they're going to do with the rest of their lives, and I have a job. We're all doing we're all doing good, and I appreciate you guys listening.
Thank you so much. Yeah.
Yeah, thank you, Doc. I
Yeah.
appreciate it.
Yep. Thanks again, Brian. Appreciate you telling your story. Encourage you to keep telling it. I know it's very impactful. Just a quick note for those on the training here. There's a link to the evaluation in the chat there to grab that certificate. I'll also follow up with an email. Um, and we'll be back in a couple of weeks with Ed's talk. Thank you.
Thanks, guys.
Thanks.
Take care. Bye bye.